It's certainly my pleasure to be here in front of you today to talk about generic drug pricing and the availability and the impact that that has on patients. And I think that's one of the things that I've heard from a few of the members of the audience and some of the questions is we are missing a little bit of aspect of the patient. Michael talked about the fact that drugs are a commodity. I would argue that they're not a commodity and they should not be treated like a commodity. They're a tool, a therapeutic agent, and the most important aspect of that therapeutic agent is they have to be used appropriately. Patients on chronic medications, we know that about 50% of them are not using their medications appropriately. This is costing the health system billions of dollars in emergency room visits, additional physician visits, and so forth. We need to focus on getting the most bang for our buck in our healthcare dollars, and medications we all know are a very cost-effective tool to be able to help provide that. So certainly I'm hoping to provide that perspective to you and explain a little bit about the process of what happens in the community pharmacy and the impact that that has on our ability to provide care for our patients. Michael did outline that, and was discussed earlier through Diane, is that the governments that are essentially going to be setting the prices for these generic medications are not the true payer. They're not paying the manufacturers for these prices. They're setting pricing and then they're reimbursing pricing through pharmacies who then have to pay wholesalers, and then that is therefore transferred on to the manufacturer side of things. We are a very large country, even though we are a small country, and there's a lot of challenges on that supply chain to make sure that Canadians have access to their medications each and every day. And there's a lot of support that comes from the manufacturer component, wholesale and pharmacy and otherwise, to ensure that our patients get their medications in a timely manner. As a practitioner and a pharmacist working in a community pharmacy, it's not unusual for me to see pages of invoices with shortages of medications. That's the reality that we deal with every single day. In a lot of cases, these are medications that we can switch to from one manufacturer to the other because we've got an interchangeable product. But there are a lot of situations where we have to spend countless hours trying to source medications for our patients. That's today. That's before really significant changes that are still being proposed and looking at for generic side of things. And it's not just generic medications, it's branded medications. But it's the reality that we live with each and every day as health professionals. We have to spend more time on worrying about supply chain management than we're actually spending time with our patients to make sure that they're using their medications safely, appropriately, and effectively. So I encourage government policymakers and insurers and everyone within the industry to really think of that in the perspective of what impact that is taking away from the time that pharmacists can spend. We've seen the generic drug pricing on everyone's slides so far, and this just highlights again the changes that we've had to date. The reality is in the pharmacy practice setting, these generic price drops are causing changes in revenue streams for pharmacies. And as Michael pointed out, the Ontario experience really did not see a substantial change in the number of pharmacies that were providing services for the patients. They saw increases. But being a pharmacy owner myself, I can certainly tell you that my gross margin dollars, the money that I use to be able to pay my staff, to be able to provide care for my patients, has dramatically dropped over the past 18 months in my home province of Alberta, and certainly that can be reflected all across Canada for every pharmacy. Those generic revenues do provide us opportunity to, again, pay our staff to provide the care that our patients require. And yes, there is still a component of the dispensing fee that pharmacies are reimbursed for, in addition to some of the allowances that are through our trade agreements with generic manufacturers. But these dispensing fees have not even kept up with inflation or the consumer price index over the past decade, and actually 2 decades on that fact. So we've got a model that is broken. It's not transparent. There's a lot of moving parts associated with it. And I don't think pharmacies are really opposed to looking at the proper model for what Canadians want and need and deserve. But I think the main thing that we are concerned about is what type of impact this is having on the patients that we see across from our counter each and every day. In addition to generic price reform, we've seen governments asking pharmacists, and our patients are asking pharmacists to do more. And this is something that, as a pharmacist, is certainly very encouraged about, and it's encouraging to see the breakdown of some of the silos in terms of the delivery of primary health care, chronic disease management, that Canadians can have access to other health professionals that can provide the same quality of service that traditionally would have been just in primary care centers. We see an aging population, a higher demand on chronic disease management, And the pharmacist, being positioned as the most accessible health professional in the community, can have a huge role to play on education and improving health outcomes for our patients, and ultimately really getting that biggest bang for our buck. So in the model that we have today, we now have expanded scopes of practice for pharmacists. They can take more responsibility for medication management. They can provide injections. They can do medication therapy reviews. But in the meantime, the revenue streams that support those activities are being cut because of changes that are happening on generic price reform. And those impact, again, the pharmacist's ability and time to provide care for your patients. So while some silos are breaking down in terms of looking at expanded scope, when it comes to drug pricing and drug formularies, we are still stuck in the silo of looking at drug prices and how that impacts government spend in healthcare and insurance companies spend in healthcare. Now is the time to break down all of those silos. That's what our patients are asking for, and that is what they need. The reason that we've seen these expanded scopes is because the system is not perfect for Canadians. Our accessibility as healthcare providers is not fantastic, and Canadians are demanding more. So I'm going to probably be the shortest presenter up here. I just have a few key takeaways that I want to leave the audience, and I'm certainly interested in seeing discussion. Lower generic prices obviously make sense. We want to see lower generic prices because it provides an opportunity to use healthcare resources elsewhere. But you have to keep in the fact of all the moving parts through this process, and I think we've heard that in a few other discussions about trying to find the right balance associated with it. Again, as a pharmacy business owner myself, I do struggle, and it keeps me up at night, how I'm going to be able to continue to service the patients that I do today in the next 12 to 18 months when we see changes and further pressures on the generic pricing and what that impacts on for me. We've got some very innovative practices that are occurring across the country, and different jurisdictions have allowed pharmacists to engage in some of those activities and reduce and remove some of the barriers that have caused some challenges to providing care for our patients, but we do need to do more for it. The model is certainly not perfect where it is today. We have now actually more administrative work and taking more time away from our patients just to try to find some of the new funding models to allow us to practice. As a small business owner, I don't have the luxury to be able to just shut down my pharmacy. Similar to many of us who have a mortgage at home, I can't just walk away from that house. I can't just walk away from that business. So I have to find ways to make sure that business runs so that I can pay my lenders back the money that I've done to borrow to own and operate a pharmacy. And that is the reality of why pharmacies aren't closing down. But what I can tell you, and I hear from my colleagues across Canada, is that we do have less time to spend with patient care because we're turning pharmaceutical services and the provision of medications into a commodity when it really needs to ultimately be a clinical service treatment tool for our patients. And certainly encourage the policyholders or policymakers in the room to keep that in mind when you're making the decisions of where Pharmacare would go, how we're going to deal with our challenges around drug pricing and delivering of pharmaceuticals to our patients. Because ultimately, it's the patients that are sitting in front of me that I'm most concerned about, and I would think that we would be doing a disservice to our patients if we don't look things in a very comprehensive manner on that front. Thank you.